Michaelis Guttman bodies are seen in A. Xanthogranulomatous pyelonephritis, B. Malakoplakia, C. Nail patella syndrome, D. None. It is seen in Malakoplakia. Malakoplakia. Correct option here is Malakoplakia. So Michaelis Guttman body is seen in Malakoplakia. DIC is seen in A. Acute promyelocytic leukemia, acute myelomonocytic leukemia, CMC, and D. CML and D. Autoimmune hemolytic anemia. So DIC is seen in acute promyelocytic leukemia. Which one? Which one it is seen? Acute promyelocytic leukemia. Which division? M3. Acute promyelocytic leukemia type M3. Type M3. So acute promyelocytic leukemia, DIC means disseminated intravascular coagulation, is associated with acute promyelocytic leukemia M3. M3. The leukemic cells of these types of anemia are hypergranular. Granules of leukemic cells, that is promyelocyte, contain thromboplastin-like material, resulting in there is a thromboplastic material which results in widespread disseminated intravascular coagulation. Majority of M3 cases demonstrate a reciprocal translocation involving chromosome T1517. So DIC is seen in acute promyelocytic leukemia. Liquefied necrosis is seen in A. Heart, B. Brain, C. Lungs, D. Spleen. Now this liquefied necrosis is seen in brain. Flare in triple response is mediated by A. Axon reflex, B. Arteriolar dilatation, C. Histamine release, D. Local hormones. It is axon reflex. Cystic medial necrosis is seen with A. Marfan syndrome, B. Friedreich's ataxia, Down syndrome, Kawasaki disease. Cystic medial necrosis. Now, this cystic medial necrosis is seen in Marfan syndrome. Cystic medial necrosis is a disorder of large arteries characterized by accumulation of a basophilic ground substance in the media with cyst-like lesion. Hence, it is known as cystic medial necrosis. It is known to occur in certain connective tissue diseases such as Marfan syndrome, Ehlers-Danlos syndrome, annulo-aortic ectasia, which usually result from degenerative changes in the aortic wall. The relationship between cystic medial necrosis and congenital heart defect, as well as other disorders, have been evidenced. So, cystic medial necrosis is seen in Marfan syndrome. Causes of constrictive pericarditis are TB, SLE, brucellosis, A and B. Correct option here is A and B. So, correct option is D. So, this constrictive pericarditis, what are the other causes of constrictive pericarditis? Tuberculosis is most common. Pericardial malignancies such as especially breast, lung, post-viral pericarditis, which is especially hemorrhagic. Drugs such as hydralazine, procainamide, minoxidil, phenytoin. Then bacterial pericarditis can cause constrictive pericarditis. Trauma, post-cardiac surgery, that is hemopericardium. Fungal pericarditis, that is histoplasmosis. Connective tissue disorders, SLE, rheumatoid arthritis, sarcoidosis. Parasitic pericarditis, that is toxoplasmosis, trichinosis. Dressler syndrome, mediastinal radiotherapy, and renal failure. So the causes of constrictive pericarditis are both A and B, TB and SLE. So correct option here is D. In cell death, myelin figures are derived from. These myelin figures are derived from A. Nucleus, B. Cell membrane, D. C. Cytoplasm, and D. Mitochondria. The myelin figures are cytoplasmic bodies composed of concentric whorls of membrane, which is derived from the damaged cell membrane. Myelin figures appear during reversible injury, but they are more pronounced in irreversible injury. So the correct option here is B, cell membrane. Enzyme that protects brain from free radical injury. Enzyme that protects brain from free radical injury is A. Myeloperoxidase, B. Superoxide dismutase, C. MAO, D. Hydroxylase. So correct option here is superoxide dismutase. Fat necrosis is common in A. Momentum, B. Breast, C. Retroperitoneal fat, D. All of them. Correct option here is D. All of them. In apoptosis, cytochrome C acts through FF1, which is activated for nuclear fragmentation of apoptosis. It is caspasis. Annexin V is a marker of apoptosis. Which of the following marker is specific for gastrointestinal stromal tumors? It is CD117. Multiple epidermoid cysts are seen in familial polyposis coli. The feature of Crohn's disease are all lymphoid hyperplasia, skin lesions, transmural involvement, cryptopsis, except lymphoid hyperplasia. Female is affected, male is not. The disease is autosomal dominant. What is the chance in children? 50% are affected. The inheritance pattern of familial retinoblastoma is autosomal dominant. Male to male transmission is seen in autosomal dominant diseases. Which is not a feature of Down syndrome? A. Clinodectally, pigmented birthmarks. C. Hypotonia. D. Respiratory tract infection. Pigmented birthmarks. Lines of jaw occur in coralline thrombus. Anemia with reticulocytosis is seen in hemolysis. Maximum spirocytes are seen in autoimmune hemolytic anemia. The anemia associated with leukemia is myelodysplastic type. Chemotaxis is mediated by leukotriene B4A and C5. Hyperimmune IG syndrome is also called as Jobs syndrome. You can click the link in the description box. You can join my 3-day NEET PG Breakthrough Blueprint Masterclass. The link is given in the description box. You can click it and join the class. It will be very helpful for you in improving your scores.